Hi, Miss Mildred. My name is Addie. I'm a student nursing assistant. I'm gonna be giving you the bedpan today. First things first, I'm gonna wash my hands and gather my supplies. I'm gonna wash my hands. This is a dirty skill, remember? So just like the emptying the urinary drainage bag, you want to go ahead and put on your gloves first, okay? Then I'm going to go grab my clean supplies. I'm gonna be going in your closet, okay? I'm gonna grab a towel. Actually, no, I need a pink a pad for barrier, okay? I tend to get the small blue one because it makes life easier for me. I'm gonna go into your top drawer over here. I'm going to grab a hand towel, right? You can leave it open if you like. I like to leave it open here on the side, okay? As a reminder that she needs to wipe her hands at some point. On the bottom should be the tissues. I'm not seeing it.
There wasn't any.
So we just assume this is the tissue, and usually I'll just hand it to the patient to use to clean when she's done. And I'm going to grab the bedpan from the, outside, not inside. Not inside. All right. I'm going to then, because then my hands is still clean regardless of what I'm doing, right? But when you do this now, this is dirty. So I'm going to go ahead and close the privacy curtain. And then I'm going to raise the bed all the way up. Only clean items go on the overbed table, right? So no time during this procedure should you be doing anything on that table, okay? And since I like to multitask while I'm doing that, I'm actually going to uncover her because I do not have patience for the life of you for anything. Okay, see that? I'm gonna place the bedpan down over here. I'm gonna bend your leg here. Bend your leg for me, thank you. And then on a count of 3, I'm gonna have you raise your hip for me. 1, 2, 3. Good, you can relax back. And then we're gonna do that one more time, okay? 1, 2, 3. Good, you can relax. Is that comfortable? Okay. Like, well, you to lift your hip back a little bit. Is that better?
Yes.
Although that's not where it should be. Yeah.
Oh, okay.
It should actually be here.
Oh,
just manage.
Okay.
Leave your leg up. I know, video understands. So I'm gonna raise the head of her bed up, okay? While holding onto the bedpan, because sometimes it will move. You're opening it for natural position. You see what I mean? Sometimes the proctor will come and pour water in here. Sometimes, not all the time. Then I'm going to cover her up, and then I'm going to lower the bed as well. Because the bed always has to be in the low position. The head of the bed stays up so she feels like she's peeing in a natural position. And then remember, this was the bedpan hand, kinda. Then I will give her a call bell. Here's your call bell. Call me when you're done. Curtain remains closed. I'm gonna step out of the room. I'm going to take out my gloves. Right? I'm gonna take out my gloves and wash my hands, okay? Immediately I'm done, she's gonna say she's done. I'm gonna wash my hands again and I'm gonna put a new pair of gloves on. I'm gonna come in and I'm gonna just do things. Yeah, you can leave it in there. And then I'm just gonna do things backwards, right? So the last thing I did was lower the bed. I'm gonna raise the bed. Then I covered her, then I'm going to uncover her, right? I like to move this down here, okay? Because I'll put her leg back out. So move that down. I'm gonna hold the bedpan and the pad together. Then I'm gonna put the head of a bed up, down. So it's just everything in reverse pretty much. And then on the count of 3, I need you to raise your hip for me. 1, 2, 3. Good. I'm gonna hold on to this, right? I'm gonna put her legs down, put her legs down. I'm going to then cover her up. I'm only one person, no patience. Patience, baby. I don't call your patience a baby. Okay, here's your call bell, right? I can, if I want right now, I could actually give you the hand wipe. So here, you can wash your hands first. since I'm gonna be all dirty anyway. I've lowered her bed, so I can always come back and, right, do the curtain, because this is dirty now, because I'm not gonna touch that with that. I'm gonna pour this in the toilet, right? In the toilet, put this in the dirty hamper. I'm going to disinfect this following the agency policy. Pour in the toilet. I'm going to wipe the bedpan, okay? I'm gonna put this back, that's why I always leave it open, okay? Okay, I see I screwed that. I'm going to take out those gloves, right? I'm gonna open my curtain. I'm gonna wash my hands, and I'll do a safety check, right? Is my bed low? Does she have a cobble? Whatever I didn't do, I'll fix it. Done, okay? Any questions?